80 is not dead anymore. 80 is a vital age for many people. And if you're 80 years old and you want to travel and you want to do things and you have good health in every other way and you're peeing in your pants, you're not going to like to hear that.
Yeah.
That it's too late.
And yet you have turned around cases where you haven't. I'm just learning about some of the things you do, but you've done sling surgery. Give us a little bit just of like highlights of what it could be, but versus what you're creating with the breath work.
Okay, so I think that I have come to understand that you don't need to have surgery for most of the conditions we see related to the pelvic floor. And when I mean related to the pelvic floor, I'm talking about urinary leakage problems. I'm talking about prolapse. I'm talking about most of the conditions that I see. Prolapse means your bladder's dropping, right? Or your uterus is dropping it. I think that for most of these conditions, they can be managed with a little awareness. And that awareness is not so hard to achieve if you're hearing things a little earlier in your life. And even if you hear it later in your life. And I mean, I've had women who've been in their 70s and 80s who've built awareness. It's harder, but they can do it. And they've gone from, diapers to no diapers. I mean, it's that dramatic. If they don't have a structural issue that needs surgery, okay? And some things we think need surgery that don't need surgery. So I have to be careful about that. But there are some people that, their bladders are hanging out of them. They have to have surgery. For most people who don't have like really acute situations like that, they can turn this around without surgery. And once the functional problems are fixed, the body has tremendous healing powers. Tremendous healing powers. If you allow your body to heal, meaning you're not creating the pressures over and over again that have gotten you here to begin with, your body will regenerate. But if you could take the pressure off the system and let it heal, suddenly the body has remarkable healing powers. And I think for most of us, we're not allowing that part to happen. We're jumping to surgery before we do that. Or we're jumping to medications before we do that. And I feel that's a disservice.
Yeah.
I think if there's a way to do things, I think all women need to hear that there's a way. Whether or not they feel that that's for them is another story. I mean, there are many people that they just want things fixed. But I have to tell you that when it comes to things like incontinence or urgency or just chronic UTIs, there is no fix. It's only you. This is one of those situations where if you don't fix it yourself, nobody can truly help you. You might get a temporary fix. You might get a temporary reprieve. But at some point, it's going to start coming back, maybe even in a different way. And you might not even think it's the same condition. You might, so in other words, you might go to the doctor and have a sling placed. That's a little mesh that goes under the urethra, and you're not having stress incontinence anymore, and you're really happy. But then you might be back in, 8 years, 9 years, and now your bladder's dropped and you have to have that picked up. Or you're getting chronic UTIs. And all because you don't know that you have a mouth on the other side of your body that you're supposed to open on the toilet. We all have a rudimentary mouth structure, okay? It is the same as our upper mouth. It's on the other side of our body, and we have the capacity to open our bottoms like a jaw, like a mouth. And that has to happen every time we're on the toilet for us to urinate and defecate without causing ourselves trauma, and to have a baby without causing yourself trauma. And if you don't know you have a mouth on the other side, you will never move it like a mouth. You will keep it closed. And you might think your mouth is weak and you will try to clamp it tighter. But you don't have a weak mouth. You just never learn to open it. And that is what my book is about. That's what The Second Mouth is about.